Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about high blood pressure.
High blood pressure is so common. Did you know almost half of all Americans have high blood pressure? And in some countries, high blood pressure is even more prevalent, where like 75% of the people have a blood pressure that is too high. So this is a common problem. And the question is, well, what does it do to you? Well, people can have strokes from it. They can have kidney failure, heart attacks. It increases your risk for almost any kind of vascular disease in your body. Another question is, why do I have high blood pressure? Well, it turns out that most people have, as they get older, an increase in their blood pressure, and that then becomes too high, and they have high blood pressure. The blood pressure in a perfect situation for an adult should be about 135/85. But for more than half now of our people, it's higher than that. So it is a problem where the pressure is too high. There are myriad reasons for it. Most of the time, we call it essential hypertension. And what essential hypertension means is there's no known cause. It just occurred over time. But diabetes, chronic kidney disease, those kinds of coronary disease, coronary heart disease can all cause your blood pressure to go up and make it worse. But most of the time, it is this syndrome of essential hypertension, which is what occurs in about 85 to 90% of all people who have hypertension.
Awesome. So if I know somebody with high blood pressure, what are some of the questions that I could recommend for them to ask their doctor?
Well, one question always is, how high should my blood pressure be? Because doctors may vary a little bit. As the older you get, they may tolerate your pressure as a little bit higher. In other words, instead of saying 135/85, that would be great, but now you're in your 70s and we can tolerate 140/90. Likewise, a real young adult should have a very low blood pressure, like maybe less than 100 systolic. So asking what the pressure is, what does it mean? How can I improve upon that? What risk is it posing to the rest of my body? And how often should I get it tested? Because it's pretty easy to get your blood tested. That's a simple test, and it's certainly not an expensive test. Now, the other question is, what medicine should I take and when should I take them? Because a lot of patients will say, you know what, I don't want to take medicine. So what can I do? What can I do? Well, can I exercise more? Can I lose weight? Yeah, both of those things would help. Take in less salt, drink less alcohol. Those are things that you could do, and important questions to ask your doctor. But most of the time, you will need medication to control the blood pressure. So if you resist taking those medications, that can result more quickly in strokes and heart attacks, things that you certainly do not want. And then I think lastly, a question might be is, well, if I over-exercised, would that help? Let's say I'll start running a few miles a day. Is that something that normally would help? And the answer is no. Losing weight. What if I'm 50 pounds overweight now and I lost that 50 pounds? Can I get a normal blood pressure because of that? The answer is usually no. And the time that it takes is so slow to lose that weight that it doesn't have a profound effect. The worst thing is most people can't lose 50 pounds anyway. So, saying I'm going to do that to control my blood pressure simply is not reality. So it's a risk factor. High blood pressure is. It's common. And as we get older, it gets to be more common and more dangerous in terms of causing heart attacks, strokes, and kidney failure.
Thanks for that overview. And thank you for watching, and be sure to visit hearthealthcommunity.com